According to World Health Organization, 5.4 million snake bites occur each year, and between 1.8 million and 2.7 million cases of envenoming are reported annually, which results in 80,000 and about 140,000 deaths. Many of snake bite victims are farmers and rural dwellers. So, I interviewed two farmers about the stereotypes about snakes and the measures they take on farm.
When the snake still
Yes.
When like say you are there now, then you are coming, snake there, you see, you hear your sound, the snake will run away. Snake do run for somebody, and a bigger snake will want to attack you. Unless if there is some snake, you may like to find something to hide.
When snake bites you,
So they will not separate.
and the first aid used,
To have first aid rather than when it bites you like that. Maybe the leg you tie am, take some rag and tie the place. Then you can rush to any nearest hospital.
which one is nearer to this place?
Now at the town now for Bola, there's one hospital at Bola.
That private hospital.
That private hospital, yes,
Okay.
specialist.
Rock specialist.
That is called first aid.
First aid, yes.
First aid, yes. Because some lives here. When before any other thing, or before they rush us to hospital, you can like here. That yesterday the woman drank kerosene. To
Kerosene.
limit the power of the poison of that snake. We use this thing. We use knife to scrape that place.
Okay.
And even we can even drop that kerosene there to reduce the power
Of the venom.
We can have some herbs that we can squish and drink.
But there has never been reported cases.
People who use traditional medicine have to know that it has some implications. It is on this that I will give advice to people who use traditional medicine that it is not standard. Traditional medicine is not fully purified. It may contain some microorganisms which are harmful to the victim, especially when taken orally or when applied to the wound site. They may introduce infection.
If they haven't gone for any tradomedical treatment, if the person presents to the hospital like almost immediately, then there is chances of survival. But if the venom has actually gone, snake venom as it is known generally, either to a layman or to a medical practitioner, it tends to ascend like to the heart. A layman will say it's going to the heart, but medically it mixes with the blood.
But hospital is far from here.
The government also have to make some effort in order to subsidize the cost of antivenom. Antivenom is costly. A simple vial of antivenom can cost up to 6,000 naira per one. And most often, people who are treated with this antivenom may require up to 6 to 7 vials, depending upon the type of the snake and its venom. The government need to make some awareness campaign, especially in the rural communities where the cases of snake bite are rampant, to mobilize the people to let them know the importance of this antivenom compared to the use of traditional medicine.
Snake bites are one of the neglected tropical diseases, and it paralyzes both the young and the old. It could also lead to death. So in support of this global rally against neglected diseases, I tell you, prevention is better than cure. Cut down the bushes around you. But when it is unavoidable, please visit the hospital. And I hope the government will heed to this call and make the hospital accessible to all.